Welcome to part 2 of our presentation. Next, we're going to talk about a couple of different syndromes that have implications for both visual impairments and either other health impairments or orthopedic impairments. Hermansky-Pudlik syndrome is a rare recessive genetic condition which impacts an individual in many ways. A visible characteristic is abnormally light skin, hair, and eye coloration or pigmentation. The oculocutaneous albinism affects the vision as well as many other medical implications such as lung disease or pulmonary fibrosis, blood clotting issues, which could lead to excessive bleeding and easily being bruised. And in fact, bleeding is considered to be the leading cause of mortality in individuals with this syndrome. So that would be a very important factor in the child's educational planning and really thinking about the eligibility category of other health impaired. Some of the vision problems that may be present include light sensitivity and nystagmus, or dancing eyes. When an educational team is determining eligibility for special education supports and services, they will want to consider the unique ways in which this condition or other conditions have implications on the whole child. Wagner syndrome is a rare genetic syndrome that results from a deletion on chromosome 11. Wagner stands for the medical and developmental problems or issues that an individual will be affected by if they have this condition. The W stands for a Wilms tumor, which is the most common form of kidney cancer in children. The A stands for aniridia, which is the partial or complete absence of the iris, which is the colored part of the eye. This can be present in one or both eyes. Aniridia is present and noticeable at birth, and the individuals will often experience other eye problems as they grow. Some of this includes cataracts, or the cloudiness of eyes, rapid and involuntary eye movements known as nystagmus, and glaucoma, which is an increased pressure in the eye that can lead to partial or full loss of vision. Both an individual's acuity and sensitivity to light will likely be impacted as well. The G stands for genitourinary, which is describing a range of genital and urinary problems in both boys and girls. The R stands for the intellectual delays in the range of developmental delays that may accompany other symptoms of this syndrome. An individual with Wagner may have 2 or more of these symptoms, but don't have to have them all. Wagner may have other implications to think about in terms of disability and eligibility for educational supports and services. There are a wide range of symptoms that an individual may experience and or receive a diagnosis of that would support different eligibility categories. For example, there are many factors that would likely impact a child's access to education under the category of other health impaired, including epilepsy or seizure disorders, chronic kidney failure, breathing problems such as asthma, as well as the implications for visual impairments based on the condition that were discussed in the last slide. When a child has a complex diagnosis like Wagner, it is critical to go through the eligibility process to determine what is the best category to use for primary and secondary disability, based on their individual needs, strengths, and challenges. This can be a challenging task, and it requires a comprehensive collaborative team approach.
Sturge-Weber syndrome, first a birthmark and then a rare diagnosis. Sturge-Weber syndrome, otherwise known as SWS, is a rare non-genetic condition resulting from abnormal development of blood vessels of the skin, eyes, and brain. The condition poses a number of specific health risks due to its progressive multi-organ involvement. Sturge-Weber syndrome was first diagnosed over 100 years ago. The syndrome is rare, with only 200,000 documented cases. Currently, there is no known cause for the syndrome. It affects the skin and nervous system. It's a congenital anomaly and a rare disorder affecting the skin and nervous system. Glaucoma is the most common eye condition that is associated with Sturge-Weber syndrome. 50% of all infants with the port wine stain will be diagnosed with glaucoma. 60% will be diagnosed in infancy, with the remaining 40% being diagnosed later in childhood. Usually only one eye will be affected. Glaucoma associated with SWS is difficult to treat, and lifelong medications are frequently accompanied by side effects. Each case of Sturge-Weber syndrome is unique and progressive. Manifestation of SWS becomes more vivid as a child grows. Since it is a progressive syndrome, students may have seizures that are exacerbated by environmental factors. The biggest need for students with SWS is communication between the school, especially the nurse and the family. The eye condition associated with Sturge-Weber syndrome is glaucoma, which could require monitoring of eye drops. Seizures are also associated with SWS, resulting in medication monitoring. Classroom accommodations. A person with Sturge-Weber syndrome may have learning disabilities due to the associated visual impairment, side effects of medications, and absences due to related illness and hospital stays. Glaucoma is associated with Sturge-Weber syndrome, which will often require classroom accommodations to assist with vision. For example, large print material, provide the student the opportunity to have answers dictated, provide frequent breaks, testing accommodations, uncluttered work areas, minimize the glare, and flexible seating for the student.
Here are some examples of some assistive devices that can be used for visual impairments.
What is Zellweger spectrum disorder? Zellweger spectrum disorder is classified into 3 categories: severe, intermediate, and mild. First described as failure to thrive, early death, congenital glaucoma, craniofacial dysmorphic features. In severe cases, infants will experience weak muscle tone, hearing and vision loss, feeding problems, and seizures. Loss of white matter in the brain and spine. Those with severe cases typically don't live past the first year. Development of life-threatening illness is also present. Less severe cases. Those with less severe cases will not develop signs or symptoms until later in infancy or early childhood. This is known as NALD, an infantile refusum disease. All have been classified together. Conditions develop more slowly, often have hypotonia, low muscle tone, vision problems, hearing loss, liver dysfunction, developmental delay, and some degrees of intellectual disability. Those with less severe cases can survive into childhood, and in rare cases may even survive into adulthood. Zellweger's and related eye conditions. Some include corneal opacification, cataracts, glaucoma, pigmentary retinopathy, and optic atrophy.
This is defined as a disorder of the cornea and occurs when the cornea becomes scarred. Treatment depends on the severity of the scarring and can include eye drops and oral medications. Some accommodations in school would include the use of sunglasses or visors when indoors, sitting with the back towards the window, using diffused or reduced lighting, attempting to reduce glare, providing high contrast materials and magnification options, as well as enlarged print, and giving children frequent breaks from visual tasks and the use of auditory materials.
Congenital cataracts. These cataracts may develop as a result of certain infections, metabolic problems, diabetes, trauma, drug reactions, and some antibiotics the mother took during pregnancy. Normal visual development is hindered if not removed. Cataracts are an eye condition that is associated with Zellweger's. Classroom accommodations may include modified assignments to prevent visual fatigue, limit clutter, and limit activities requiring a lot of visual scanning. Another condition associated with Zellweger's is pigmentary retinopathy. This mimics retinitis pigmentosa. It is the presence of retinal dystrophic and pigmentary changes, night blindness, reduction of visual acuity, and constriction of visual fields. Optic atrophy is also associated with Zellweger's. It is characterized by tunnel vision. Both eyes are affected equally, but the severity of vision loss varies. Difficulties with color vision. Some school accommodations may include supplement visual learning with tactile and auditory information, high illumination of materials, low vision training in early childhood, visual stimulation in infancy and early childhood. If photophobia is present, student may need enlarged print, magnification, avoid visual clutter and busy backgrounds. They may also need Braille and present visual information in isolation.
When thinking about goal setting, we want to remember to be specific, measurable, attainable, relevant, and ensure that the goals are set in a time-bound frame. Here are some examples of equipment that could be used for children with visual impairments and or multiple disabilities, including other health impairments or orthopedic impairments. They can be used to encourage and support movement and coordination safely, or materials that can be used to encourage exploration and purposeful movement, or having opportunities to provide postural support and positioning to offer different learning opportunities and experiences for children. Finally, we want to just remember that at all times when thinking about children with any types of disabilities, we want to ensure that we remember abilities always outweigh the disabilities. Thank you.